think there's really this idea that you can have it all and you can do it all. And I don't believe that that's true 100%. I think you can have a lot. I can't be the world's greatest oral surgeon and the world's best mom. You can't do everything. So sometimes you just have to kind of pick and choose.
Welcome back to another episode of the Doctors and Dollars podcast. I'm your host, Nate Crannell, joined today by Dr. Erin Sheffield. Erin is a board-certified oral and maxillofacial surgeon at the Quincy Medical Group. After growing up in Utah and attending BYU, she completed her dental school and oral surgery residency at the University of Iowa. Go Hawks. She now holds an associate professor position there. When Dr. Sheffield isn't at work, she loves spending time with her 3 young children and her husband. She played lacrosse in college and is a certified scuba instructor. Got some questions about that today. She enjoys piano, cycling, and working on her historic home. Welcome to the show, Erin.
Thank you for having me.
So I want to dive in talking about when you were a kid. So like I mentioned in the bio, you grew up in Utah. Were you that like stereotypical like snowboarder, mountain biker, outdoorsy kid that everyone thinks of when they think of Utah?
Yes, minus the skiing, snowboarding part. So
yeah,
it's kind of embarrassing to my pride that I lived in Utah for the first 21 years of my life and never once went downhill skiing or snowboarding. And now that I just turned 40 and I'm on probably third year of learning to ski, that my Iowa husband had to take me back home to learn to ski. And it's really not good timing. It's kind of freaky, but it's pretty fun. But definitely, I recommend learning when you're younger. So just trying to keep up with my kids who are learning. So, but definitely the camping and all that.
For sure, yeah. I went to Colorado skiing growing up, probably from age 6 to 16. We'd go out there every year and ski in Breckenridge, and it's always fun. It is kind of like riding a bike. You know, you only do it 1 week of the year, and then you go back out there and you pick it up in the first 20 minutes. But what do you think is? Yeah, exactly. So your kids are going to feel that. What do you think doing it at 40? What do you think something that you've learned? You said this is your third year, so like from year 1 to year 3, what's something that you've learned about yourself when skiing?
It's really humbling. I decided that skiing is one of the very few things in life that legitimately like 2 to 4 year olds are like way better at me, way better at it than I am. So I remember the first time I went, I was doing pretty good on the bunny hill. And so my husband was like, let's go on this bigger hill. And I was not ready. I couldn't slow down enough. So I was just like screaming, and I finally made myself crash because I felt like I was out of control. And this little kid just skied by me and he's so sweet. But they're like, are you okay, lady? Do you need some help? And I was like, no, I don't need help from you.
Not from you, kid.
No, leave me alone in my shame as you ski away. Oh, yeah. So
that's funny.
It's a lot of fun. I'm enjoying it, but it definitely, I mean, you know, these are my money makers, and you know, that's definitely a concern. It is easy to get hurt doing that sport. So it's a lot of fun, but it definitely makes me feel my mortality.
Yeah. I say, I haven't skied since I was probably, I was 15 or 16, and I'm getting up close to 40 as well. And so I want to get my kids out there. My wife has never skied. Her biggest thing though is crashing. She's like, even if I figure out how to do it, she's like scared to crash. I'm like, just do the pizza. Like, just do the pizza with your skis, and you'll enjoy yourself.
It's fun. I mean, I encourage her to give it a try, but yeah, it gets you out of your comfort zone, which I think is good. I like to say yes to things, even things that sound scary or, you know, terrifying. I try to say yes as much as possible. So I'm saying yes to skiing, but it's a lot of fun, but I definitely try to just be as careful as I can. Getting old.
Is there anything? Yeah, for sure. Is there anything that you make Abe, your husband, do outside of his comfort zone that's fun for you but scary for him?
Oh boy, my comfort zone encases probably a lot more things than his. As far as probably more like social situations, I'm extremely extroverted, and he says, you know, when you go to like a party or something, you just light up. You're this whole excited interesting person, and he's much more the introvert. So probably just on a frequent social basis.
That makes sense. I think you and I will get along then, because that's me and my marriage is I'm the outgoing social, and I love to go to places, and I get like excited to talk to a bunch of different people.
Yeah.
Whereas my wife is like, if we say nothing the entire time we're there, I'd be totally fine with it. So.
Well, he's great socially. I mean, that's an interesting thing. He's an introvert, but I feel like everyone who meets him just instantly loves him. But he puts up with just a lot of me dragging him along, or being my TikTok, or
yeah, there you go.
To all my TikTok live people, and it's like, oh, okay, fine, tonsillitis or whatever the question is. But.
There you go. Are you pretty big on TikTok? I feel, but I mean, I have one, but I like downloaded the app and I haven't done anything with it. But is that your go-to?
Fun on TikTok. I don't know what the definition of big would be. I have about 13,000 followers, so I have a small group of people that are pretty loyal, I guess. So.
I probably have like 13. So yes, you would be considered big.
Well, then that's a lot more. So yes, I'm very big, the biggest. So you'll find me.
There you go. I'll look you up after this.
Yeah, sure.
One thing that you weren't afraid to do, which I thought was super interesting, college lacrosse. That is a tough sport. I mean, I have a lot of my friends growing up played college football. I have friends that played college rugby. College lacrosse it's legit. Tough sport. Tell me about your experience at BYU doing that.
Well, you do have to understand that women's lacrosse and men's lacrosse are actually two pretty different sports. So I still think it's pretty legit and pretty intense, but women's is not a contact sport. So we even wore skirts when we played. So takes that part down a little bit maybe, but
more finesse.
Yes, it's definitely about the finesse. And if you know anything about lacrosse, you might have noticed there are two different sticks. So the men's lacrosse sticks are much different. They have a pretty deep pocket. And I think part of that's to hold the ball in place when they're getting hit with the sticks, or we call it checked. Women's lacrosse, the sticks are evolving a little bit more to kind of cheat, to have a little deeper pocket, but especially when we used to play, the pocket is the depth of the sidewall. So it really is not much of a pocket at all. So really is about finesse and speed and skill in women's lacrosse. And it's a lot of fun. And I was lucky to get to play on the club team at BYU, which is great.
That's awesome. Did you play at Iowa when you made your way over there too?
Yeah, I actually played for a year or two at Iowa while I was in dental school also. And Iowa lacrosse is just in its baby stages. So it was definitely a different vibe, but I had a lot of fun trying to kind of help build that program and participating still. For
sure. What year were you there that you would have done that?
That was probably about 2005, 2006, maybe. Mm-hmm.
Gotcha. Yeah, because I had a friend that played. He was on like the club team, the Iowa rugby club team, and then he did some lacrosse a little bit. Then, if I remember right, that was like just getting started. From a men's perspective, that would have been 2006 or 2007. So, yeah, right about that time. Did you ever need any of the work of a dentist or an oral surgeon because of lacrosse?
Luckily, not because of lacrosse. Definitely recommend a mouth guard. They are required for lacrosse, at least when we played. So I definitely recommend a mouth guard for pretty much any sport. That's my dental plug for you.
There you go. Well, I have some questions later that you'll need to give more dental plugs. So
okay, sure.
Hold on to those. But yeah, I only asked that question just because there is the contact sport of men, and even when you say the women's side is more finesse, there's still the lacrosse ball that you're throwing around that you can easily take one of those to the face. You can easily take a stick to the face. Well,
one of the sad things in my adulthood about lacrosse is that it's not a pickup sport. So I live in rural Illinois, and unfortunately I don't have anyone to play with because you can't just go throw around. Not many people can even catch the ball or throw the ball well enough to even play catch. And then if you don't know the rules, it's very dangerous because we can still check each other and hit the sticks, etc. And so I would get skin fingers all the time, and people hitting your hands, or you could take it to the face. So even though it's non-contact, there's no joke when you're swinging sticks around.
For sure. When was the last time you picked up a stick?
Oh my gosh, probably 10 years. It's sad.
Oh wow.
Yeah.
That should be your Valentine's Day goal today. Go out to the garage and grab yours and just kind of swing it around a little bit.
Yeah. Probably be pretty rusty, but it would be fun.
Yeah. That's like me in golfing. I golfed all the time growing up. I golfed in college. get a career and you start having kids, and those types of things just kind of go to the wayside. Where I used to golf 5 times a week, and now it's like 5 times a summer.
Yeah, definitely.
And it makes it tough. So yeah, I had one of my buddies he's in North Carolina that, I mean, he golfs all the time just because the weather's better there. And last time we played was right around Christmas in North Carolina. And he's like, hey, when you come back, like, yeah, no. Yeah, in North Carolina. And so we were just texting each other, and I was like, I literally haven't touched a golf club since we played around Christmas. And he's like, oh, geez, I played 3 times this week already. Well, that's the difference.
Really
that's why,
but when you're a parent and you have all the moving pieces of your life, it's hard to stick with those things.
It happens. Yeah. He's about to become a parent, so he'll figure it out. Yeah. One thing they also don't have in the Midwest, I don't know if you've noticed this or not, is oceans. But you are a scuba diving instructor or a certified scuba instructor and diving instructor. Tell me where that came about, because that's very random for someone from Utah that lives in, grew up more in Iowa and now lives in Illinois. How did scuba diving come about?
Yeah, when I was in college, I took a PE class. It was a scuba class, and just randomly, my parents also took some classes. We didn't arrange it or anything or coordinate, but we all just kind of started diving at the same time, and it really became a passion for our entire family. So we go on big dive trips all the time. And I graduated from BYU undergrad a semester early. So I was done in December before I started dental school in the summer. And so my dad, who I think had some good insight, was like, this is the last kind of chunk of time that you have to do something all for yourself. And you should think about going to Utila, Honduras to become a dive master. And I never heard of Utila, Honduras. If you're familiar with that area, good for you. It's pretty kind of obsolete or obscure place in the Caribbean. It's a small group of islands, part of the Bay Islands in Honduras. And Utila is a dive hub or like a backpacker hub. So at the time, it was probably the cheapest place to do dive certification besides Thailand. And that was right after the big tsunami kind of wiped out Thailand. So, and all the diving industry. So people just travel there, a lot of backpacking, budget travelers, and go and learn how to dive. And so I thought that was a good idea. So I went down and lived there probably about 3 months and just worked as a dive master. So it's a pretty intensive program. It's basically an internship. So every day you're schlepping takes onto the boat and helping your instructor teach classes and taking a bunch of classes and doing a bunch of tests, etc. And then finally, at the end of that, after it took me almost exactly 3 months, I became a dive master. And I really regretted that I didn't have enough time to stay and become an instructor. So went back home and started dental school. And I decided that my short little window of time between first and second year of dental school, I wanted to meet my goal of becoming an instructor. So I went and spent that summer in Thailand and took the course and became an instructor. So the tricky part about that is coming back to Iowa, not a lot of places to teach diving. I tried to get kind of hooked up with the university, and they weren't very business minded and wanting me to help find new people. They thought I was kind of stealing people from them. So sure. I wanted to bring like all my dental school friends in and teach them and give them some of the fees. And because dental students aren't typically taking dive classes because they're busy. But anyway, didn't work out. But I was able to teach some of my family members and things, some extra courses, but haven't had a chance really to teach. But I really just enjoy the training that I was able to do, and the extra learning is great. So
that's very cool. Aside from Honduras or Thailand, what are some of your favorite places that you've done some dives in?
I usually like diving pretty much anywhere in the Caribbean. The nice thing about the Caribbean is it tends to be warm and the visibility tends to be great. Cozumel is always great. They have a lot of really fun, they call it drift dives, where they drop you off and the currents can be pretty swift. So they just kind of take you along and then the boat picks you up at the end. So that could be a nice place. Utila is probably my favorite place just because I'm the most familiar, and I've done over 100 dives in Utila alone. So that's always a place in my heart.
Very cool. So you're probably pretty good at like snorkeling then as well, because that's all I've ever done is snorkel.
I think if you can dive, you can snorkel pretty well.
Yeah. I think I've actually done snorkeling in Cozumel and Cayman Islands and out in Hawaii. We went to Maui when I was in like 7th grade for one of my dad's like work trips, and it was like a old ancient volcano that was under the water, and so they like drop you off under there, and you can go down, I don't know, 30, 40 feet is about as low as you can get, and it's you can just see like the very top edge of the volcano and all the coral that's growing on it and stuff. I just thought that was really neat. But I'd imagine Honduras has some pretty cool stuff. Anywhere in the Caribbean has some cool stuff like that.
Well, it's just nice because everywhere you go is a little bit different. So it's just fun to see the differences in different locations. And then I'd say the diving in Thailand, and I did a lot of diving in Malaysia, was there too. It's just a lot different too, the topography and the animals that you see. So it's exciting. I tell people it's basically like underwater hiking. It's just an opportunity to see what's under there. And I think they made a mistake kind of targeting the extreme sports people. I mean, when they started scuba, took it from like military to recreational, you had to be kind of the extreme people because there just wasn't the equipment and the gear and the training necessarily. But now it's so streamlined, it's so safe, and people think it's so scary, but you can make it scary, but you don't have to dive in the deep, dark places where you can only see this far in front of your face. You don't have to do the cave diving and things like that. You know, it's kind of like snorkeling. Most people aren't afraid to dive down when they're snorkeling. You can dive back up quickly if you need to, you know, those kind of situations. If you're diving safely and following the rules, should be very safe. So,
yeah. Are a lot of your vacations now, let's say in the last 10 years, are they kind of framed around like, hey, we're going to go somewhere where I can suit up?
Kids, remember the kids thing.
Oh yeah, that's true. You got to get them in.
Before that, I would say yes, but probably my kids are 8, and then we were doing fertility treatments, so probably the past 10 years, very minimal diving. But we have our first dive trick in a really long time coming up this summer, so I'm really excited.
That's exciting. See, this is going to be a big summer for you. You're going to start diving again. You're going to pick up a lacrosse stick, and you're going to start playing. You're going to get all this fun stuff done. I do. Well,
take you back my life.
There you go. That's awesome. Well, you did that's cool that you kind of fitted in, you know, post undergrad before you went to dental school. And then even it sounds like in between the first and second year of dental school, you're squeezing it in. So that's a great segue into my next question, which was around really the sequence that you have to follow as an oral surgeon to my understanding, is much different than any other, you know, physician might have. So talk to me about, you know, that higher education process of oral surgery and kind of the sequence that goes along with it and why it's so different.
Yeah, definitely. So oral surgery training starts with dental school. So in most instances, that's going to be 4 years after completing undergrad. And then, which is
not easy to get into.
No, so it's very challenging. I think it's getting more and more competitive. So yeah, so you finish dental school, and then to apply, one thing that's changed since I was a student is that in order to apply, you have to take a special exam. And I think basically it's an exam that's kind of similar to Step 1 medical boards. But the tricky part, there's a few tricky parts about it. One, you have to decide early enough on in your dental school career that you want to be in the program, oral maxillofacial surgeon, or we can just say oral surgeon, that you have time to prepare and take the test. You're also studying during dental school, which is very rigorous academically. And then it's basically, again, like medical boards. And a lot of it is crossover in what we're learning academically in med school versus dental school, but a lot of it is not. So some of that stuff is stuff you've never seen or learned before, and you just have to pick up on your own. So I think that's the first challenge. And then once you get into a program, or once you're applying for the program, there are 2 different ways you can go, 2 tracks. So there's a single degree track, which is typically 4 years. And then there's a dual degree track where it's 6 years. And 2 of those extra years, you actually go back to medical school and become an MD. That's a little confusing for people because about half of us, which would be me, are single degree 4-year program. Other half of us are dual degree, or they're dentists and physicians as well. But besides extra years of medical school, the training is essentially the same. It is a hospital, usually based residency, surgical residency, on par to any other surgical residency, I would say, as far as like how busy you are and the things that you're accomplishing and doing. But that's kind of interesting, especially the MD side. Now, I have a lot of friends who they would rotate with us, like the ears, nose, throat doctors would rotate on our team, including my husband. I was a chief resident when he was my intern, and that was fun. I got to teach him to take out teeth and stuff. But a lot of those people would be like, oh my gosh, I love this specialty so much. Can I change? And it's really hard to go backdoor from like med school into, you'd have to do at least a portion of dental school, et cetera. And that'd be tricky. So you really do pretty much exclusively have to go the dental track to get there.
They throw anesthesia in there as well.
So a big part of our training is anesthesiology. So I would venture to say, besides anesthesiologists and nurse anesthetists, were probably the most highly trained individuals in anesthesia. So probably they change the requirements every once in a while. I think it's probably 6 months of anesthesia training now. So basically you're just acting like one of the anesthesiology residents, running rooms, putting patients to sleep, intubating them, just like they do.
Why is it, do you think, that they, besides the anesthesiologists and the nurses that you mentioned, I don't even want to try and say that word, but why do you think it is that, why do you think it is that you're like the third most trained in anesthesia?
Well, anesthesia is a huge part of what we do. So when you think about, say, having your wisdom teeth removed, that's kind of the thing people think of us for. Most of our patients are doing sedation for that, which is a form of anesthesia. And even though it's maybe a lesser form of anesthesia, we're not going so deep as you would in the operating room. We have to know how to take care of you in case anything were to happen, or say you went a little deeper than we expected. We have to be able to take care of all those situations. So it really prepares us to be ready to take good care of our patients and keep you safe, because we're kind of like operating our own little mini surgery center in our office every day. And I don't know really too many other people doing that, or other specialties, maybe GI for like colonoscopies, et cetera. But we really are using anesthesia every day, and so we have to make sure we're keeping everyone as safe as possible.
Yeah. So then the obvious question, then, with probably an obvious answer, is that there's not an anesthesiologist like on staff administering all of that as you go into each oral surgery. You guys are doing it on your own.
Well, usually I would say some surgeons will hire an anesthesia provider to come and help them, or help them just either be more quick and efficient, or just to add extra layer of safety, because certainly if you have someone else helping you, an extra set of hands and eyes can be good. But most, especially like private practice oral maxillofacial surgeons, are going to be the anesthesia provider as well as the surgeon in their practice.
Gotcha. That makes sense. What do you think you're doing a majority of your time? Is it wisdom teeth? Is it jaw restructure? What are some things that you're working on?
Me personally, I focus more on the bread and butter aspects of oral surgery. We call it dentoalveolar. That's the tooth and jaw portion. So that's where I spend most of my day. So I usually do wisdom teeth in the mornings, or bigger cases, big denture, taking out all the teeth or things like that. But I also spend a lot of time doing dental implants, or we call it pre-prosthetic surgery, bone grafting and things like that, to prepare for that. And then sometimes I'll do bigger cases. We can do trauma or reconstruction or plastic surgery. There's a really big scope. Kind of most of what is here in this head and neck region is something that we are allowed to practice. It's just kind of what you feel comfortable and what your program trained you on, or what education you received on what you decide to perform.
What got you excited about what you do? I mean, it's like you said, you went to undergrad, and then it's like going into, you could have decided medical school, but you went to dental school. You decided, to go into the surgery side of things versus just becoming, maybe a private practice dentist. Like, what got you excited or interested in doing what you do?
Well, again, going back to the scuba part, I was really interested in marine biology, and I wanted to be a marine biology professor. I wanted to spend part of my time diving as part of my research. And I did a semester in the summer in Monterey, California at the Stanford Marine Station there. And I just realized I'd probably be spending most of my time looking in an aquarium at snails all day. And again, the extrovert in me couldn't handle that. So my sister and my dad were like, I was kind of devastated. Like, I have no idea what to do with my life. And they were like, you should be a dentist. A dentist would be a great career for a woman. And I did like the idea of the flexibility that dentistry seems to offer compared to medicine. Having a family was something I really wanted and was important. So I feel like there's a lot more flexibility in that regard. And then once I started dental school, I knew I was interested in surgery, but honestly, I'm a fainter. So it's embarrassing to admit. But I was doing a pre-dental class where they're talking about, this and that. Consider this before you go in. And these are the different specialties. And this oral surgeon came in and he was doing a wisdom tooth surgery. And I was like, oh my gosh, they did that to me when they took my wisdom teeth out. And I went in the bathroom and passed out. I'm definitely a fainter. And so it was one of those things like, well, I think it's really cool, but I'm a fainter. I couldn't possibly do this. But the good news is, even if you're a fainter, you can get over it and get used to it. The first day I took out a tooth on my oral surgery rotation in dental school, I just loved it. And I just felt this could be something I'm good at. I just felt like I had aptitude for it. I really enjoyed it. And so I started looking into it a little more. And I talked to one of the professors who happened to be a woman oral surgeon. There are very, very few of us. When I was almost done with my residency in 2015, they published a study and it was like 2.8% of board certified oral surgeons are women. So the fact that there was a woman there to even talk to and be a mentor was really important for me. So I talked to her and she was a mom and she really encouraged me that I could do this profession and have a family and make it work. And so, both of those things really kind of helped push me over the edge and to give it a try. I still was a fainter a little bit. I passed out my first day of residency in the operating room, but now I'm doing it and I haven't fainted in a really long time.
What is it? Do you think there's like a psychological aspect to it of like the experience of you doing it yourself, you don't faint, but if you're watching somebody else perform the work, you're like, oh gosh, because you don't have the control, right? If you're doing it yourself, you can control the circumstances.
Well, I think some of it for me, when you personalize it, like for me again, like, oh my gosh, someone did that to me. That was a lot more of like a kind of thing. I used to be needle phobic also, and I could pass out with that. When you get more exposure therapy makes a big difference. And when you start to see things more frequently, you just get used to it. So thankfully I've seen most of those things. I guess if I went maybe in another specialty where they're doing something really weird I haven't seen, maybe I'd feel a little queasy still. I hope as a surgeon, my surgeons probably would say hopefully not, but who knows? I don't know.
Yeah. See, I have that phobia just because I'm one of those annoying people that I've never had a cavity. I didn't have braces. Still have my wisdom teeth.
How do we make money off of you?
Exactly. Dentists probably hate me. I
hate people like you. Oh,
yeah. I'm sorry, but it's just good genetics, I guess. But like, so I have like the inverse phobia of like I get scared to go to the dentist because I'm just waiting for that thing to like, man, you're in your mid 30s, you've had a good run, but here we go. Let's fire away and start hacking away at your mouth. And so that scares me every time. But it is kind of a good feeling walking out every time. They're like, yep, just a good cleaning and you're good to go and no cavities. And we'll see you in 6 months. We love
people like that. We do.
No, you don't.
No, I mean, we do. You're our people. We like the people. I mean, there's this idea that we're all like glad that people are getting cavities, et cetera, because it keeps us working. But like, honestly, I think as a profession, we'd be really happy to lower that from happening. We'd find other things to do.
That's true. There's some compassion there.
Yeah.
But so you brought it up, and it was something I was going to talk about as well. So you're passionate about advancing women in the field of oral surgery, just because probably more than any other medical specialty, and maybe I'm wrong with this, but like there's just such a huge skew in terms of male to female ratio. You said like 2.8% 8%. That's crazy low. Are there specific barriers to entry for women in that field? Or, is it just historical population in oral surgery has been men, so women kind of reconsider pursuing that field? What do you think it is?
I think those are tough questions to answer fully, and I think there is research being done on that. I had the same question, and I was, required to do a research project in residency, and that's actually what I my project on, because I noticed, my husband was in medical school, and all of his female friends were choosing residencies after, and some of them very vigorous, or surgery, like general surgery, very busy, neurosurgery, extremely busy. And so I thought, clearly it's not just like the 4 to 6 year program afterwards, because that's kind of like, oh, well, more residency time. That must be why women aren't choosing it. And clearly they're doing it, and women in medicine, are matching numbers, or pretty even, or maybe even a little higher than men. But in dental school, we're just really not catching up. Dentistry in general has been very heavily dominated by men, but I think dental school is now probably like 51% female, so maybe slightly higher. But I don't know. My project maybe hinted to a few things. I think some of it is the idea that, and kind of like what I mentioned before, women who are choosing dentistry as a career are choosing it partly for the lifestyle. And so when you're choosing dentistry, you're expecting to go into it and have it be a 4-year deal and be done. So adding on an extra 4 to 6 year residency probably is a challenge, or maybe not what you expected. I think mentorship is a really big thing. I think you have to see yourself in that position to decide to pursue it. And I found that before my sister and my dad recommended being a dentist, I'd never considered it because I'm from Utah. I'd never met a female dentist, as weird as that might sound. Never in my life had I ever met a female dentist. And so it was kind of like saying you should be a welder, or, some other traditionally male-dominated field. Not that I wouldn't think I could be a welder. I could be a pretty dang good welder if I put my mind to it, I'm pretty sure. But
as long as you don't faint, yeah.
Yeah, well, yeah, exactly. I probably would. It gets hot under there, probably. But I just never had considered it. I never saw anyone doing that looked like me, that would make me think, oh, I could maybe do that too. So I think that's a big part of it. And I think there's just a little bit of fear. That was something I noticed when I interviewed like first year dental students compared to senior level dental students, and their views on oral surgery seemed to swap more positively as they got older, so maybe a little less fear or intimidation or just misunderstanding of what the specialty was. But I think that's part of it. And then it is so male dominated. I think some of the women that want to get into it, it's just still hard to break your way in. Hard to find those people that are supportive or look enough like you that maybe feel like you could even possibly take that on. But I don't know. That's something we're definitely, I think, diving into and looking into more. But hopefully it changes. I mean, like I said, that stat that I read, I remember it being 2015. Now we're at about 8% of women. So we're certainly making huge strides. That's a really big jump in a short period of time. So it shows that we really have a lot of women joining our ranks, the young women, but we just don't have a lot of older women in positions of leadership and positions where they're making decisions or being highly visible. And so I think that makes a difference as well.
Yeah. As I was writing that question, those were some of the thoughts that you said were what I was, if I were to answer that question, those would probably be some of my thoughts as well. As it's not necessarily an education standpoint, because you and I both know that women are smarter than men. It's more of a clearly, obviously. I think it's more of a demographic experience, if that's a phrase, to where going into that program, you just are surrounded by males, because I'm guessing most of your professors and the mentorship and the leadership within that dental program were mostly males. Like you said, you had never seen a female dentist growing up. Whereas I'm on the inverse, like my dentist growing up in my hometown was a female. And then now my dentist here in Des Moines, Iowa is a female as well. So it's like, I've only had female dentists, but that's uncommon as I understand. So I think it's more of I think it comes down to the leadership side of things where, as as there are positions open and there are leadership and mentorship opportunities within all of the dental schools for women to take on some of those roles, I think they need to take those, because then other women who come into dental school and are trying to figure out what track, do I want to be a dentist? Do I want to go into oral surgery and do that longer residency? Is that something I want to do? If they have more women around them to say, yes, you could totally do this, keep going, I think that will raise that 8% even higher. I think just unfortunately, there's that historic factor of there's just men everywhere in the dental world. And that's just, it's kind of hard to break that mold when it's kind of perpetuated, with each graduating class.
I think it's just so important to see people that are like you, whether that's like a racial thing or a gender thing or just a value thing. I think you have to be able to see yourself in that person and that lifestyle. So I think even in dentistry, a lot of the residencies are lots of other residency programs you can do, but most of those are more like dental school based residencies. So, if you're becoming a pediatric dentist, that's a couple years after dental school and it's intensive, but it's more like the 8 to 5, you go to the dental, it's kind of like more dental school where, a hospital based where you're on call. We'd be at the hospital for 36 hours straight most of the time, like when you're on call. And so I think that's kind of a hard jump. It sounds so intense coming from the dental school side, where if you're in med school, you did that a little bit in your rotations. You worked nights and you worked weekends and you saw people doing it and you saw women, hopefully in some other specialties, having families and making it work. And so I think sometimes even then is just being able to see women like myself who I have a family and I make the hours work for me and I'm doing things that I'm not just only living in the hospital. I'm not a slave to my job or my career. And I'm able to have some of those things that a lot of women are wanting and value, that maybe without seeing someone modeling that, it's hard to understand if it's possible.
So that's why I think it would be important for someone like you to be able to have that type of mentorship to younger female dental students, just because they can see, okay, she's on the other side of it. She started a family and she's done those things and is in practice, right? And so I think that could be the other side of it. Besides the demographic side, I think there's also the maternal side. Like as you're going through, your residency program or even through dental school, you're like, I want to have a family. And so I think maybe a lot of women just look at it and be like, well, man, if I got to do dental school and then another 6 years, like you're just pushing that clock further backwards. It's like, man, I just, I really want to be a mother and that's just not something I want to commit to. And so, I'll stick with the 4 years of dental school and then just whatever gets me in my career sooner so that I can start a family sooner. I think that might be part of it as well. And,
oh yeah, definitely.
Unfortunately, guys don't have that same thought. I think as they're going through dental school, they're not thinking about like, man, I want to start a family. How do I get through this as quick as possible? And so they're just like, they're probably thinking, what's going to make me the most money or what's going to make me build success faster. And then, the family will come with that. But
oh, yeah, definitely. I mean, most of the residents in my program, we were when I was there, kind of family-based program. So most of the residents there were married and most of them had kids, and it's a whole different vibe when you're a man versus a woman. I feel like that's even maybe a positive, like, look, he's so committed and he's got a family at home, so he's a responsible guy, like you're choosing that person partly because of that. And yet if you were a woman and you told them or hinted that you were planning to have a family anytime soon, or maybe you already had a family, I know people get like questions like, well, how are you possibly going to take care of your child when you're in resident, like all of those things kind of work against you. So there's definitely a double standard. Yeah.
Well, I know in talking with your husband on a previous podcast, while you guys were both, I would call it in training, right? Whatever points in that process looks like. He's an otolaryngologist. He was in residency. You were no longer in residency. And you guys had twins. Talk to me about the struggles, but even the triumphs that come with, becoming parents while both of you are in what I would call training.
Yeah, definitely. Well, I started attempting to start our family the last year of residency, and I had infertility issues. And so we ended up doing in vitro fertilization to get pregnant. And that alone was very difficult. I had it perfectly planned.
Yeah.
At the end of my residency was when I was going to do my embryo harvest or my egg harvest. And then we'd have a couple of weeks off. And then I was going to do the transfer where they actually try to get you pregnant, like right before I started my first job after however 13 years or whatever of school.
Sure.
And it's just perfectly planned. It's just gonna be perfect. And then things weren't quite progressing as I expected. Mother Nature, you can't control Mother Nature. So
Yep.
they had to push things back on my harvest. And so it meant I was going to need to try to get pregnant the day I was supposed to start my job. And that was devastating.
That's when the actual,
when they
you
like
probably know
put
the phrase
the
better.
embryo back after it's
Yeah,
been,
the embryo back. Yep.
Yeah. And the test tube, it's not really test tube, it's more of a petri dish. That was devastating because like this is like the pinnacle of my life. The first day, private practice. This is what I've been working towards for over a decade. And what do? It just put me in such a dilemma. Do I call my new boss and tell them, I'm sorry, you have to cancel all of our patients on the first day because I'm trying to get pregnant? And a lot of, I would say, naive friends, of course, just call them and tell them. And I was like, I just don't think that's going to go well. I don't think that's a good idea. So instead, my doctor, we put all the embryos in the freezer and we decided to wait. So that was also devastating after doing all this stuff, medications and hormones and shots. And again, needle phobic person. So shots and shots and shots, terrible. And so, we had to put them back in the freezer for a while, and then trying to get pregnant with infertility treatments during a job, you can't really keep it secret for long because you have to have an ultrasound almost every day, and it depends on how things are going, so you can't really plan ahead. So I did have to discuss with my boss. So that in and of itself is tricky just from a privacy standpoint and coordinating your schedule. And so that part alone was just difficult. And then after many, many rounds that failed, I finally got pregnant, ended up being triplets. So that was like a whole other vibe. Like we didn't transfer triplets, we transferred 2 and 1 split. And so I'm thinking, how am I going to continue working? Like, am I out of a job? Am I quitting my job? I ended up losing one of the babies really early on, but then, twin pregnancy. And that's scary too. Am I going to be on bed rest? Am I going to make it? What's going to happen in my practice? I was commuting 75 miles each way at this point for my job.
Wow.
And I was the only doctor working at my job. And so there's a lot of pressure on me to keep things open. And they planned on finding a locums person while I was gone, but never did. So when I was out, the office was closed. So I was really lucky. I worked up till 36 weeks. I did have to take a couple weeks off because I was in preterm labor, but luckily the baby stayed in. So overall, I was able to work pretty close up to the time we were going to deliver the babies, but that was really tricky. It's hard. If you do it in residency, it's very inconvenient for all the residents who have to pick up the slack. And then are you making up extra time, etc.? But when you're in private practice, it's not easy either, because if you're not working, you're not bringing home any money. And there's a whole group of people, patients relying on you, staff relying on you. And so that's a really tricky thing to maneuver. And then just going back to work with little babies and going back sooner than you wish you could. And it's twins. And that's just the whole other vibe. So twins are amazing and such a blessing, but the first 4 months are a total blur. And the childcare didn't work out like we thought. My boss originally said I could bring the babies to work, which was amazing, and then went back on that. So we were kind of in a bind. A lot of times you have to have childcare lined up for 6 months in advance, especially with babies. So 2 babies. So kind of the only way we made it through, because again, my husband was in training. If he'd been on his normal surgical rotations, I don't know what we would have done. But luckily he was.
Did you have help from parents or friends? Or
parents, thankfully, were in town, so got a lot of help from them. And then he was on a research rotation, so his hours were a lot more flexible. So thankfully, during those first few months, he was able to be home a lot more and doing some things there. But it's really tricky. I don't know how people do it as the mom in residency and having twins. I don't know how anyone does that. No, you do it and it's a blessing, but it's a lot.
Yeah.
It's just a lot. It's a lot to manage. And I look back on it, it's definitely kind of a blur at that time of life. And I don't feel like I answered your question very well. There's just so much you could say.
No, I think you did a good job. I mean, I have insight because we have 3 kids. I have a little bit of insight just because my younger sister has twins as well. We actually have their first birthday here this weekend.
They made it. Everyone survived.
Yep. Twin boys. But again, her and her husband, they work in corporate America, work from home remotely. So that's helped a lot. They do have, childcare and things like that they do, but not to the extent of what you guys went through, having Abe in residency, you in private practice, so many more moving parts than most people who have twins in that first, let's say, 6 months of their life. I just feel like you guys had, just hearing your story from Abe, and then, you actually went deeper into it. Just hearing that, like, you have so many moving parts, especially in private. I didn't know you were in private practice. And so you have other families relying on you in what you're doing. So how did that get navigated? If you took that 6 weeks off, was the office just closed during that time, or how did you guys
the
work
office
through
was
that?
closed. And that was a whole other level of drama. They wanted me to come back earlier than I felt comfortable. Honestly, 6 weeks is not enough probably for any mom, but especially after having twins. And we had a really scary labor, and they were very healthy overall, but just had a few things we were still checking out and making sure. My son had a little bit of maybe bleeding on his brain, so we're like checking some things out like that. And they weren't nursing well, and we were trying to do that, and so weren't sleeping. I was not studying for boards. I had to take my oral boards, shortly after. So it's just so many moving pieces. And the office manager wanted me to come back at 4 weeks. And I said, no way. I said, the state of Iowa, where I was working at the time, gives me 6 weeks by law, and my doctor does not want me going back yet, and the babies are still having some issues. So luckily I was able to push back a little bit, but I don't think that was well received. And so coming back to work, there was a lot of, I'd say, harassment as retaliation for that. And I ended up inviting someone else I knew who was finishing residency to come join me in the practice, because technically it was at least a 2-man practice. And once he signed on, they let me go. I personally believe it is retaliation for taking my maternity leave. And they essentially kind of told me that. So that's a whole other can of worms, where I ended up filing with the EOC and, having some legal actions taken there, and ultimately came to an agreement. But that was a really difficult time.
Man, that's just a whole nother layer on top of that is unfortunate. And it's just kind of a sign of the times when all that was happening, that, in your specific field, that's, you may not be the only person that's happened to, but good for you for standing up for yourself. Because I can't imagine they come in and say, hey, I'm bringing in this second person to help me. And then they think, well, yeah, this person who's fresh out of residency is going to do a better job than you, so we're going to let you go based on performance. I can't imagine that would be the case.
Yeah, so. I mean, it's sad that things like that happen, and they definitely do. And just all the legal part of it was honestly hell to go through. But I just felt like I had to stick up for myself, but mostly for just women in general. This is not okay, and I am in a position where I'm leaving and I'm not dependent on this job. It's okay if it gets awkward or difficult, because a lot of women can't stand up for themselves, or, they're too afraid for retaliation and all that. And just because it can't happen by law doesn't mean it's not an uncomfortable place to be or whatever.
For sure.
So it's really difficult, but I found myself, a couple years out of residency filing for unemployment, which after doing that many years of training and working that hard and just giving your whole self to become this surgeon, to not have a job. And I'm in Iowa, in an area that's a little overserved in some ways because of the university and all the people that want to stay because they like the university in the area, and not having a job. And I'm just like, I got these 2 babies. I'm the main provider for our family because my husband's still in residency, and I'm just looking at like being unemployed for who knows how long. Thankfully, I just luckily came upon a part-time position after, calling someone up, hey, could you use me? And they could, but that's just a scary thing that could happen. Just seems really unfair, but luckily it worked out, but you just don't
I think it goes back to our conversation earlier of like, I would almost guarantee, but I can't 100% guarantee that private practice has never had to experience that before because they've had male surgeons prior to that.
Right.
And so that's just not a part of their HR system that they've had to activate, right? Is thinking through that. And so that happens a lot in other industries, I think, of there's always that tricky, what do we do when it comes to maternity leave and how do we handle this and how do we make sure that work is getting done?
Right.
But honestly, you still always have to go back to just being human beings and saying, okay, what's best for the mom? What's best for the mom that had twins? And like, how do we find that common ground of like the business still operates while she's out? And then how do we make that transition good? I mean, as a business owner, and I've had employees and employees are pregnant, like you have to have communication and talk through it and find that common ground. You just have to be a human being.
I thought about it on the front end of my contract. Should we ask about the maternity leave policy? And that's something that I think would be wonderful for everyone to talk about. That'd probably be advice that I would give, but also it's such an uncomfortable thing to ask. And I'm not going to pretend everyone I ask that question to is going to receive it in a positive way, because now suddenly like, oh, so are you planning on having kids? And when you do have kids and, oh no, she might be wanting to have kids, like just even asking the question, I feel like might sour them on you or make them question your lack of your commitment. And so I don't know how you navigate that. I mean, maybe from a business perspective, you have some, advice, but I think that's my advice definitely would be to have that conversation. But can you always have that conversation, especially when you're in a male dominated field where they don't always respect that, especially that older patriarchal generation of like, you give your life to your surgery. That's, who you are and what you are. And it's all for your patients, there's definitely a different vibe where now I feel like doctors are much more looking at a holistic view of the person and trying to hopefully have some positive life outside of work, but I think the older generation tends to look down on that. And in our field, it tends to be older men making those decisions, and what they view as professional is very different than what I view as professional.
Yeah. Hopefully there's just some attrition of that generation, right? That has that mindset and to give your life and your soul to surgery and to your practice. Yeah. I think as a business owner, I've just always had the thought of like, you're starting a family, you're a human being first, right? And so if you plan to have children, like just let me know. I think every employer should have within their employment contract guidelines around maternity leave and have it set in stone. Like, here's what it is, and we'll stick to it. There's not going to be hey, we're going to make you come back sooner. If there is you're going to come back later, I think it has to be very clear of like, if you're going to go longer than 6 weeks or 8 weeks, it's unpaid or it's 50% paid. But as long as it's all very clear so that when someone is starting to work for you, they know what to expect when that happens. Yeah, I just think that's the most important thing is transparency, I think is what I'm getting at. And so
yeah, sure.
For sure. So even now, as you and Abe both have, full-time careers in your respective specialties, how are you guys finding balance in your time and energy, at Quincy Medical Group, but also, captaining the ship of the Sheffield family? How do you guys find that balance?
I think for me, and for us as a couple, I really think you have to figure out what your goals and your values are for yourself and to pave your own way and not be afraid to kind of ask questions or buck the system a little bit. So for us, we knew we're both surgeons, but we're very family oriented, and our lives could go two different directions. We could both be in the hospital and at work all the time, and our kids might never see us, or we can frame our life in a way that we can actually be present. And that was really important to us. So we're like, why would both of us need to work 80 hours a week? We don't have to do that. And so we have been a little more flexible in our hours and things than maybe some of our other colleagues. We're not necessarily working the traditional surgeon's hours of like 7 to 5 or 8 to 5 or whatever. And part of that was finding a location that had the same value system we did. So I remember when we were interviewing, we kind of realized you kind of got to ask for what you want up front, because after you come, they're less excited about wooing you, you know? So if there's something you want, like ask for it and see if you can get it in the deal. And so I remember him saying, we were interviewing in the Southwest, he told the recruiter, he said, you know, ultimately, I would love to work like 4 days a week. My wife and I are both surgeons. I don't think we need to work full time. So if you can let them know that's something we'd like to negotiate. And the recruiter just scoffed at him and was like, you cannot say that. How could you even expect that? You can't ask for that. Don't tell anyone that. Don't even hint at anything like that. You can not expect something like that, especially starting out. That is unreasonable to ask. Don't let anyone hear you say that. And we were kind of surprised, like, really? But if that's what we want to do, like, why wouldn't we be open about it? And so it was kind of like, oh my, did we really overstep? Like, are we crazy for thinking this could happen? And then we came to Quincy Medical Group, and that was a huge thing that lured us here, is that the docs are going, oh yeah, I go in at 6:30 in the morning and see a couple patients, and I walk home and have breakfast with my kids. And then I go home and I walk home and have lunch with the kids, and then I'm done at 3. And I do, you know, like they were tailoring their schedule to exactly how they wanted and making their life work for them, while also taking great care of their patients and getting their jobs done. And they were so happy. As long as their doctors were happy and were being productive, you do whatever you want. You take as much time off as you want. You make your hours whatever you want. And so that was so refreshing to us to find somewhere where we could practice how we wanted to practice. So, you know, I'm not saying that everyone's in a position, in every position, where you can change your hours or dictate the schedule or go against maybe the culture, but there are places out there that are willing to let you be a little more creative or to practice in the way that you want to practice. And so the way we do it, you know, I work 3 days a week, and when I'm there from like 8 to 5, 8 to 6, and I'm just there grinding out, getting it done. And I'm probably seeing about as many patients as like my partner or other people do in the 4 or 5 days that they work. Dentistry, even oral surgery, tends to be more like 4 days luckily. And then my husband, he goes in a little early. So he's maybe going in at 7:30, and then he's getting home at maybe like 3. So he's home with the kids in the afternoons. And so I feel like we've both been able to make our schedules really work for us, that we get to be home with the kids. The kids feel like we're there, and just not get so set in, you know, the ways that you're told it has to be, or kind of the traditional, again, what's professional or what's not. We do what we can to make it work for us. And I still think we do a really good, or maybe better job, taking care of our patients.
Absolutely. It's quality over quantity, right? You said right there at the beginning, like you guys could both be working 80 hours a week in any other practice, or just by choice, and you guys would never see your kids. But I think it's the quality of the hours while you're at work. You know, you said 3 days a week. I'm presuming, you know, probably gets you like 30 hours a week, ballpark.
Pretty close.
Somewhere around there. But it's like those 30 hours, you're all in, you're not doing anything else. So the quality of your time when you're not working those 30 hours is so much better. Versus, I mean, I think we all can agree, if you're having to work 80 hours a week, you're not going hard for those 80 hours. Right. There's downtime.
Probably are, because surgeons are a different breed. True. But I mean, it wears on you. True. And things have to give. You know, I think there's really this, especially for women, this idea that you can have it all and you can do it all. And I don't believe that that's true 100%. I think you can have a lot. I had to kind of decide, I can't be the world's greatest oral surgeon and the world's best mom and the world's best president of the Quincy Montessori board. You know, like you can't do everything. So sometimes it's a timing thing, and you can only do this then and that then. Or maybe instead of being the world's best, most famous research, groundbreaking oral surgeon, I could be Quincy's best oral surgeon while I'm there. But when I'm home, you know, you just have to kind of pick and choose. And maybe later I can be the world's best, most famous research oral surgeon.
There you go.
Choose, you know, but right now that's not the that's not the vibe. I'm not working 100% full time, but I still think I'm providing an amazing service to our community that needs us.
Absolutely. I would agree. That's awesome. I'm going to end up with a couple questions around specifically your specialties. So like when we were communicating before this, you had said, hey, mouth questions, dental surgery questions, fire away. So I'm going to take you up on that offer just out of curiosity from some things that we've experienced as parents or that friends of mine have experienced. But so the mouth and jaw development can be very impactful on the rest of the body. So like before and after a surgery with patients, what are some things that you're helping them learn about and helping them understand about the importance of good health in the facial region, as it relates to mouth and jaw?
Yeah. I think we're learning more and more how the mouth and the teeth impact the rest of our health. For example, there was just a study that came out that showed that mouthwash can affect blood pressure. And so that's something that seems really random and unrelated, but our mouth is really important. And I think one of those things we're going to be learning more about is the microbiome of the mouth. So I think, we're hearing a lot about the microbiome of your gut and how that's really important. And some of the bacteria in our gut might even have to do with our brains and depression and things like that. I think that if that matters in our gut, then it's got to matter in our mouth, which is connected to our gut. So I think the good thing I've kind of realized is a lot of those same things that are supporting our health in general, like nutrition principles, et cetera, are also supporting our oral health. The same things that are good for our blood sugar or good for our diets in general are also the things that are going to protect our teeth. So I think it's just really important to see our mouths and our teeth as important. A lot of people, I think some of it has to do with the way dental insurance is. Dental insurance makes teeth look kind of like a luxury thing, like having teeth is a luxury. And because they're not willing to pay for a lot of things and it is expensive, I think a lot of people think that their teeth are kind of just nice things to have. And like, well, I could have a dental implant to replace this tooth, but since insurance won't pay for it, it's not worth it. Or I hear a lot of people say at my age, it's not worth it. And I'm like, I've heard people say that at 40 and I've heard people say that at 80. At what point is your mouth and your teeth, which is something you use every day to talk with and to eat with and to smile with and to breathe with, all of these things are happening all day, every day. At what point do we value and appreciate that? I don't know if that answers your question, but it's a lot more important than people realize. And even things like just missing a tooth, that can cause a lot of problems just with your bite, or overloading the other teeth can lead to cracking of the other teeth, or tipping can contribute to things like sleep apnea, et cetera, if you're missing teeth because they're supporting the face and the jaws, which is, I think, kind of what you were asking about before. So yep. I think we're going to learn more and more over time just how important some of those things are. I see sleep dentistry really becoming more popular, and we're learning a lot more about that. We didn't talk about any of that when I was in dental school, which longer than I thought, almost 20 years ago. But it's really becoming a thing where we're realizing the mouth and the airway are so important for our health.
Yeah, and that's why I asked. My dentist is big on the connection between sleep and dentistry around it. And it really arose from my youngest, my 5-year-old son, was sucking his thumb, right? Which is something that you see a lot. And so he had a high palate, was sucking his thumb. You could tell it was like affecting his jaw, like his actual bite down. And then he just was not sleeping well and was snoring. And we're just like, 5-year-olds typically don't snore. It's just not a normal thing. And then there was the bedwetting as well, which he's probably going to look back at this podcast 10 years from now and be super embarrassed that I just said that. But like between the thumb sucking and the bedwetting, our dentist was just like, there's the development of his mouth is just not supporting what he's doing. So if we can get the thumb sucking to stop, there's things that we can do. And there's this munchy thing that he munches on to kind of retrain the jaw to get back in the proper spot. And she said that could cure the bedwetting thing too, which I didn't understand how all of those are all connected. But it comes down to the snoring. And
that's really kind of a topic that's in vogue. And it's something I don't know as much about it as I would like to, but it's something I'm really interested in. Also, I think there's something called like myofunctional therapy, which is basically getting the teeth and the jaws and the tongue and all that to work in the right way to support the airway and the development of the face, et cetera. And I think it's really compelling and interesting. I think sometimes it's kind of the idea that when you have a hammer, everything's a nail. I think sometimes they're kind of attributing everything to the position your tongue's at, and not everything I don't think is fully related to that, but I think we're learning a lot more about that. And as an oral maxillofacial surgeon, one of the big things that we can do is jaw reconstruction surgery, where if your jaws are not fully developed or in the right position, we can break your jaws and move them and put them in the correct position. And a lot of times that's super important for airway, but I see a lot of people, they don't prioritize that, or they don't want to go through that surgery, which understandable to a point, but they just want, so when you go talk to the orthodontist, people are thinking about wanting straight teeth, but they're not always thinking about how your jaws are aligning. And so a lot of times they make, I think, the wrong decision with the orthodontist, which would be just make the teeth look straight and fit together as best as they can without getting the jaws in the correct position. And that can lead to a lot of problems down the line, like sleep apnea or wear and tear on the jaws, or, you know, the TMJs or the teeth themselves. And it tends to cause relapse where the teeth don't actually stay straight because you pushed them too much out of their limits to really be able to stay where they need to go. So I wish people could kind of see that global aspect, that the teeth in the mouth aren't just cosmetic, but there's a lot of functional things behind it too. And again, I think a lot of that goes back to people just look at teeth as elective. That sounds weird, but you know, your insurance company kind of tells you, yeah, you lose a tooth, and they tell you you don't deserve a dental implant, unfortunately, to replace it, you know. So
it is what it is. Yeah. That I think it will change in the future, but as more science comes out behind how all those things are connected. And I think eventually dental insurance will catch up and say, okay, this is more of a health risk than just a cosmetic concern. And so I look forward to that day, because that'll be nice. But again, hopefully I never have to go through that. The last question I have, or second to last question I have for you, and this has just been curiosity for a long time because I've never understood it. Wisdom teeth. Why the heck do we have wisdom teeth? Like, why is that a thing? And then why do some people have to get them out when they're 12? I feel like in junior high, a lot of my friends were getting wisdom teeth out. And then like myself, and I know other people that still have them. Like, give me kind of the science behind all that.
Yeah. So wisdom teeth, there are a lot of theories for why we have them. Probably the most likely one is just as we have evolved from more the Neanderthal style man with the big, thick jaws and a lot of space to, you know, more modern man, our jaws have gotten smaller and they just don't have the space to accommodate that extra set of molars. So they tend to get impacted and stuck in the wrong position. Other people think maybe with wear and tear, as you were chewing, et cetera, if you lost a tooth, it was kind of like your bailout tooth that could move into position over time and, you know, fill in that gap. I don't know that I really believe in that option necessarily, but probably just has to do with our mouths and jaws getting smaller over time is why we have them. So just kind of this remnant evolutionary product. Unfortunately, they don't do much good for many people. So you're right. Yeah. Most of us, or many of us, are having those removed. And why do we have to have them removed? If they're impacted, and impacted means they're stuck underneath the gums or the bony part of the jaw, at least partially, they don't have enough room to fully erupt or come into the mouth to be chewed on. And so if they're impacted, especially partially impacted or kind of half in, half out, those tend to lead to a lot of problems. So you can get decay on those teeth, infection, cysts or other pathology that can cause some really big problems, gum disease, etc. So a lot of different problems that can happen. And there's a couple different mindsets that you can look at. Should we take them out preventively, or should we take them out later if they cause problems? And we have a model in the U.S. is more the preventive thing, to have them out when you're younger, as usually a teenager. And the timing that works best would be to look at an x-ray and see the development. So it's going to be different for everyone. But most of the time that sweet spot's going to be late teens, or, you know, probably 16 to 19. But like, for example, from what I've heard, like in the UK, they tend to remove wisdom teeth only when they cause problems. I think that's because they're socialized medicine, so they don't want to invest the money in preventive removal for everyone. And so when you think about that, less people are having them removed, so less people are having complications from having them removed. But when they have to have them removed, it's usually at a later date. And as you get older, after age 25, the studies have shown the increased rates of complications, like 150% chance of having a problem, more increased chance of having a problem. So when they do have their tooth removed at a later date, it tends to be higher chance for things like nerve damage or much more difficult recovery. It's more painful. It takes longer, more time off work, higher chance for infection, dry socket, all those things. So I tend to agree with the preventive option, removing them when you're a kid, hopefully before they cause problems, because we can really minimize the damage that occurs or the amount of time off work. It's kind of like having your tonsils removed as an adult. Most people know that it's much, much worse as an adult than as a kid. So a lot of times we're taking those out before they ever can have a chance to become a problem. Now, someone like you who has your wisdom teeth, I assume that they're fully in position and they're not like half covered by gum tissue. Those are people that I recommend, yeah, sure, if you want to keep them, you can. A lot of times we end up taking those out also, though, because it's hard to get your toothbrush back there. Some people, you can't even fit your toothbrush back there, and they tend to get decay or gum disease. So even then, a lot of times we'll just remove them.
Gotcha. Yeah, that's kind of my worry with them is like eventually I'm going to wake up and be like, oh man, I have a toothache, and I go into the dentist and they're like, oh yeah, you've got infection back there and we need to go in immediately. And yeah, I've been thinking about it more lately is because I remember right, the x-ray one is like sitting normal and it's just back there. I don't know, it just seems like another tooth. But then I have another one that's like sideways. Like one tooth is like this, and then on my right side it's like sideways underneath my gum still.
Oh yeah.
And it's never bothered me, but yeah, they always bring it up. They're like, well, do you want us to look at those? I'm like, it doesn't hurt. Nothing bothers me. So let's look at it again in 6 months.
The idea of it hurting or not isn't always the best way to make a decision. You know, I always tell patients, a lot of people have heart attacks and they don't even know, or, you know, their arm is what hurts and not their heart. So our body's not always good at telling us it's a problem. But I do tend to tell my patients, again, because 25 was kind of that arbitrary cutoff on the research, that it's harder to have them out. You know, if they're doing fine and we don't have any compelling reasons, like it looks like it's infected, or, you know, we can see the tooth poking through the gums, then a lot of times I just recommend leaving them at that point. And if it does cause a problem, then we take on the risk of removing it.
Yeah. Okay. That makes me feel a little better then.
Yeah.
I'll just come to you to get
them out.
Come
see me. I'll take a look. Send me your x-ray.
You bet. You bet. Sounds good. All right. So what is next, Erin Sheffield, professionally and personally in 2024?
Oh boy, that's a big question. I always have things in my mind of what I want to do next. Professionally, I'm trying to work on making my practice more what I want it to be, if that makes sense. I've been building and building and building, you know, to get the number of patients, et cetera, and to be the level of busy that I am. And now that I'm there, I'd like to do a little bit more to just kind of make it how I want, see more of the patients, the kind of patients I want, et cetera. Would like to do a little more on like the global aspect of the profession. You know, I have a few lectures coming up at our annual oral surgery meeting that I'm going to be participating in and things like that. So hoping to just get a little more involved on social media and the lecture circuit, et cetera, just to have a little more, I don't know if you'd say influence. I'm not trying to be an influencer in a way, but I do think it's just really important, partly, again, for more female faces to be seen in our specialty. And so I guess that's probably my other goal, is just to try to put myself out there more as someone that other women can look to as a mentor or as an example.
That's awesome. Admirable. And it's one of those things where if you have the voice and you have the confidence to do it, I mean, you're kind of doing a disservice if you don't. Right.
Well, I mean, there's that question of like, why me? And I've thought that a lot. You know, I'm not a famous surgeon. I don't really have anything more special than anyone else as far as, you know, I've kind of realized we're all kind of experts in what we do. And so instead of why me, kind of more, why not me? You know, I can be there and be willing to step up and to help educate and be there. So
that's the way to do it. Well, I'm glad you came on today. I really enjoyed our conversation. You said off camera before we started that you didn't want to laugh. See,
Oh, well,
there you go.
I can't help
I'll go
it.
back and keep track, and I'll send you a text with how many times you laughed, because
Okay.
my goal was to get you 5 times. I know I hit 5, but
Well,
I
I'm
want to know
sure
how
you
many.
did. It's not so much how many times, just my cackles. I've heard myself on other podcasts. It's kind of embarrassing, but I am
That's
who
all
I
right.
am. The embarrassing hyena laugh. Someone told me that when I was a kid.
Absolutely. It is not a hyena laugh, but
Well,
and
thank
it's not
you.
embarrassing at all. So you
Oh, I
bet.
appreciate that.
Well, I look forward to when our paths cross. I think we're going to see each other
Okay.
here shortly at the Physicians Financial Summit in
Yeah, we're
Chicago.
super excited. We're
Uh,
going to be there. Can't wait.
we'll be sure to keep in touch, but appreciate you coming on.
Yeah, thank you.